Karthika from Department of Biomedical Engineering, SNS College of Technology, Coimbatore. Today we are going to discuss about a case study on ionizing radiation in medicine in medical physics. First of all, what's the use of ionizing radiation in medicine? Here we have three main uses of ionizing radiation in medicine. First one is treatment, second one is diagnosis, and the third one is sterilization. For better understanding of ionizing radiation in medicine, we consider cancer treatment as a better example for this. First of all, what do you mean by cancer? We know that cancers are growths of cells, cancerous tumors which are out of control. As a result of this, they do not perform their intended functions. See this one. This picture, it clearly shows the cancer cell formation in human body. Okay, and while moving into the treatment of cancer, we consider chemotherapy by using drugs and radiation therapy. In this we have two types, radiotherapy and brachytherapy, and the third one is surgery. Okay, and the factors which affect the choice of treatment for cancer, we have to consider the size of tumor and the position of the tumor. Okay, and the main aim of radiation therapy is to cause damage to the cancerous cells while minimizing the risk to surrounding healthy tissue. Here, the damage of the infected by radiation therapy causes the cancerous cells to stop reproducing and thus the tumor shrinks. Unfortunately, healthy cells can also be damaged by the radiation. So, we have to maintain a proper planning for treatment using ionizing radiation. Okay, then why does the amount of radiation given to the patient have to be accurately calculated? Because the amount of radiation given to the patient has to be accurately calculated so that the damage is limited by the cancerous cells only. We have to destroy only the cancerous cells, not the normal cells. Okay, for this, radiation therapy uses ionizing radiation to treat the cancer, to destroy cancerous cells. There are two main techniques we consider. First one is radiotherapy, second one is brachytherapy. Okay, in this, we have to give a proper planning and simulation and treatment for each and every patient to destroy cancer cells in the human body. Okay, first one, in radiotherapy treatment planning, first we have to identify where the cancerous tumor cells are presented. By using X-rays, CT scans, MRI scans and ultrasound images, we can identify the cancerous tumors. First, from the right side, we have MRI image, ultrasound and X-rays. Okay, in radiotherapy treatment planning, once the amount of radiation is given to the patient is accurately calculated, the patient then goes to the simulator to determine what settings are to be selected for the actual treatment using a linear accelerator. Okay, while moving into the treatment, here this IR radiation using high energy gamma rays. In this irradiation using high energy X-rays, based on the applications, we have either gamma rays or X-rays. Okay, and radiotherapy treatment, this radiation using high energy gamma rays, we can have the Gopal 60 source, a radioactive form of Gopal. This Gopal source is kept within a thick heavy metal container. Here, this container has a slit in it and to allow the narrow beam of gamma rays to the cameras. Okay, and next irradiation using high energy X-rays. Here the X-rays are generated by a linear accelerated LINAC. These X-rays produced are shaped into a narrow beam by movable metal shutters. Okay, and here see this one. Here the apparatus are arranged so that it can rotate around the couch on which the patient lies. This allows the patient to receive radiation from different directions. Here the diseased tissue receives radiation all of the time, but the healthy tissue receives a minimum amount of radiation possible. Okay, here the treatments are given as a series of small doses because cancerous cells are killed more easily when they are dividing, and not all the cells divide at the same time. This reduces some of the side effects which come with radiotherapy. Okay, and radiation therapy using brachytherapy. This involves planning and placing implants in the form of seeds, wires, or pellets directly into the tumor. Such implants may be temporary or permanent depending on the implant and the tumor itself. Here, the tumor receives nearly all of the dose while healthy tissue hardly receives any. This is the main benefit of brachytherapy. Okay, see this one here. Brachytherapy is used to treat the following cancers: uterus, cervix, prostate, intraocular, and skin, also thyroid and bone. Okay, then what's the use of tracers in radiation therapy? There are many uses of ionizing radiation based on the fact that it is easy to detect. In such applications, the radioactive material is used in the form of a tracer. In nuclear medicine, a tracer is a radioactive substance which is taken into the body either an injection or a drink. Such a substance is normally a gamma emitter which is detected and monitored. This gives an indication of any problems that may be present in our body organs or tissues by how much or how little of the substance has been absorbed. So we can have traces for treatment and therapy. Okay, then why is a half-life of a 6 hours is more important? A shorter half-life would not allow sufficient measurement or images to be obtained. A longer half-life would increase the amount of radiation the body organs or tissues receive. Okay, and what do you mean by this gamma camera? Here, a tracer is injected into the patient. A radiation is emitted from the patient is directed using a gamma camera. A typical gamma camera is 40 cm in diameter and large enough to examine body tissues or specific organs. These gamma rays are given off in all directions, but only the ones which travel towards the gamma camera will be detected. Okay. And a gamma camera consists of three main parts. First one is a collimator and a detector and electronic system. See this one. This picture it clearly indicates the gamma camera. And in diagnosis part we have static and dynamic imaging. First one is static imaging. There is a time delay between injecting the tracer and the buildup of a radiation in the organ. Here static studies are performed on the brain, bone or lungs and scans. And in dynamic imaging, the amount of radioactive buildup is measured over time. Dynamic studies are performed on the kidneys and heart. Okay. Next one is the renogram. Renograms are dynamic images of the kidneys and they are performed for the following reasons: to assess individual kidney or a bladder function, to detect urinary tract infections, to detect assess obstructed kidneys, to detect and assess vesicoureteric reflex, and also to assess kidney transplants. And also we have a normal renogram images, and also this shows the abnormal renogram. See the difference. And in previously we have discussed ionizing radiation is used for sterilization also. Here radiation not only kills the cells, it can also kill germs and bacteria. Nowadays, medical instruments, syringes are pre-packed and then irradiation using an intense gamma ray source. This kills any germs or bacteria but does not damage syringe nor make it radioactive. Okay, while coming into summary, ionizing radiation is used in radiotherapy to treat the cancer or to sterilize medical equipment because it destroys cells. Radioactive tracers are used in nuclear medicine because the ionizing radiation it emits is easy to detect. Okay, there are three main uses of ionizing radiation in medicine, and this case study it talks about treatment, diagnosis and sterilization using ionizing radiation. In this, radiotherapy is used to treat cancers by irradiating them with ionizing radiation. Radioactive traces are used to diagnose and investigate several medical conditions. Ionizing radiation is used to sterilize medical equipment as it kills germs or bacteria. So, in this case study, we have discussed about ionizing radiation in medicine and why we prefer ionizing radiation in medicine, particularly for treating the cancer and anything which any big problems in human body. In this, we have discussed about ionizing radiation treatment, uh, how to use ionizing radiation as traces, and also discussed about diagnosis and sterilization using radiation. Thank you.